Baker, then Speaker of the House, we've got to pass this law so we can learn what's in it. And I dare say, and I won't make a bet, but I would bet that 3/4 of the members of the United States Congress never read that thing. And it's some question as to whether the president ever read it, because he doesn't act like it. But just when you thought the new health care law couldn't get any worse, next year, you don't know what's down the road. And every American is going to suffer the impact. That's the latest warning from our next guest, one of the nation's leading experts on this bill.
Millions of Americans were shocked to learn that the health care plan they liked and could afford was considered a substandard or cut-rate plan under President Obama's health care law. And because of that, their policies would no longer be available in 2014. But that's not the only thing that will disappear next year. Betsy McCoy is a lawyer and healthcare policy expert who has pored over every detail of the healthcare law. She says if you have to get your insurance on the healthcare exchanges, you may no longer be able to see the doctor you want or use the hospital you prefer. And she says everyone in America will eventually go from receiving world-class medical care to getting Medicaid-level care.
Well, she's an expert. Betsy McCoy is with us right now. She joins us from New York. Welcome back. Delighted to see you.
Well, thank you. And here is the 2,572-page law, if you can see it. And the fact is, whoever is elected president next time, whether it's a man or a woman, should make a pledge not to sign any bill that's over 20 pages and not to sign that bill until he or she has read that bill. After all, 20 pages should be enough. The framers of the Constitution established the entire federal government in just 18 pages.
Betsy, honestly, just between us friends, do you think the president has ever read that whole bill?
No. He would not have stood up there as he did some 36 times and said, if you like your health plan, you can keep your health plan, period. Because it's quite clear in this law that everyone is going to be required to enroll in the one-size-fits-all essential benefit package. It says it right there in the law.
Well, what is the deal? The whole idea is that we're going to move the well-to-do into a socialist system where they're going to fund those who don't have any money. Is it single-payer deal that they're looking at?
Yes, there are two premises behind this law. The first is that we're too stupid to pick the kind of health insurance we want. It would be like passing a law that the only car you can buy is a four-door sedan. No more hatchbacks, no more convertibles. We might not know when to put the top up. And the second presumption is that we can force healthy young people to pay exorbitant premiums, not for health care they're going to consume, right, but so the money can be shifted over to help people who are seriously ill with pre-existing conditions. It would be much smarter and fairer and more direct simply to spend the money on the people who have the pre-existing conditions. Do you realize that the federal government is going to spend another $700 million very soon on an advertising campaign to woo young people into this plan? The money should be spent on surgeries and medicines and doctors' fees for those who are critically ill, but instead they're going to be dumped from their plans.
It looks like there was some kind of a fix. What jammed this thing through? They had no Republican support whatsoever, and it looked like this thing was enormously unpopular, but they jammed it through. Who did it?
That's right. They jammed it through. First of all, they jammed it through the Senate on Christmas Eve in violation of the Constitution, which says all bills that raise revenue should originate in the House. They took a House bill that had nothing to do with health care, and they stripped every word out of it and then filled it with the Affordable Care Act and passed it. It was a sham. It was unconstitutional from the beginning. And I wonder sometimes why so many members of Congress put loyalty to the president or loyalty to the party ahead of loyalty to the U.S. Constitution. They took an oath to uphold and defend the Constitution.
Next year, you said it's going to really get bad. What's going to happen next year?
Well, unfortunately, I hate to be the bearer of bad tidings, but we've seen about 5 million people already get cancellation notices in the mail. These are people who had individual plans. They bought them on the health insurance market themselves. But now the other shoe is going to drop because millions of people who get their health coverage through a job, their own or their spouses or their parents, they're going to get those letters, or their employer is going to say, you know, these new government requirements are so costly, I can't afford to provide health coverage anymore. And what's unbelievable is that Congress was warned before they ever passed this law that fewer people would get on-the-job coverage after the law passed than if it didn't pass. Imagine that. The Congressional Budget Office said it would decrease the number of people with employer-provided health coverage, and they passed it anyway.
I mean, they just selected amnesia in Washington. What is the deal? It was almost like a fix, like a miasma settled over that. Or was it miasma? Is this the thing they want? They want to move us into European-style socialism?
Well, clearly many people in Congress do want to do that. But at this point, when we see Obamacare crumbling, the members of Congress have an immediate obligation to stop the bleeding. They need to help the 800,000 people who have serious pre-existing conditions because, you know, 35 states already have high-risk pools where those people can get insurance, and many of those high-risk pools are closing down at the end of December, leaving those people totally uncovered. Some of them are in the middle of chemotherapy. I think Congress should right now repeal one part of this law, Title I, which includes the individual and employer mandate and the one-size-fits-all government-designed health plan, and instead they should take that money, $26 billion this year and $51 billion the next, and provide coverage for the people with pre-existing conditions and the people who are otherwise going to lose their individual plans. That's what they should do, and the rest of it they can decide after the next election. But this isn't just about politics. There are people out there who are really hurting because of this law.
Actually, people are going to die, aren't they? They will die.
They are. There are some people may even die. I hate to say that, but some people will not be able to get the health coverage they need because of those politicians in Washington.
Can people, doctors can opt out of this thing, and they don't want to treat the patients, and many doctors, I guess, just are leaving their practice. What are they doing?
Let me give you an example. In New York, 24%, only 24% of doctors, less than a quarter, are willing to participate in these exchange plans. And wherever you are, if you sign up for one of these exchange plans, chances are you are not going to be able to use the doctors and hospitals you currently prefer because these exchange plans pay much less than current commercial insurance plans pay doctors and hospitals. It's Medicaid-level care. And so if you're in California, you can't go to Cedars-Sinai under most of these plans or to the University of California hospitals. If you're in New York, you can't go to the top-drawer New York Presbyterian system. In New Hampshire, 10 out of the 26 hospitals were excluded from the only plans offered in the state.
What is America going to do? I mean, we've got this president for another couple of years. I mean, what's going to happen? You think the midterm elections, they're going to be a dramatic shift? It sounds like there's going to be a revolution.
Well, I'm so glad you asked because we the people, can make this 2014 election a referendum on the Obama health law. 2012 should have been, people got distracted, but 2014, they can go to the polls and pull the lever for somebody who's truly committed to eliminating this law because otherwise all of our health care is going to suffer.
Thank you.
If we have time, I'd like to...
Oh. Go ahead, please. You got some more. Go ahead.
If we have time, I'd like to give just a couple of practical suggestions,
right,
not political. If you're a baby boomer, line up your doctors now, your cardiologist, your internist, even if you're healthy, because if you wait till you turn 65 and go on Medicare, you will not find a doctor willing to take you on. And if you're going to the hospital and you know it already, try to cobble together enough money for a private duty nurse at least the first night, because the cuts under Medicare pays for over half this law, cuts to Medicare, and the cuts to what hospitals are paid are so severe that they're already laying off nurses and spreading the care too thin.
It sounds like you're like Paul Revere of healthcare. I hope people will listen to you because you're one of the few who knows what you're talking about. Thank you so much. Please come by.